Hi everybody, welcome to the Mom series, The Misunderstanding of Multiplicity. My name is Maria. So today I want to do a video on a little subject called body dysmorphia, which I think is often neglected in the DID, MPD community. It is people talking about what body dysmorphia is in the very real sense of not seeing yourself as you are. There's body dysmorphia, and then there is, and people have discussed this, psychiatrists and doctors have discussed this, like, are they having an acute form of mind-body disconnect, which is exactly what happens in body dysmorphia, where it's like an optical illusion because they're over-focusing, or are they fearful, having anxiety response, or do they really see themselves as a different person? Okay, so I think we all maybe have, some of us, I don't know about all, but I know some of us can relate to looking in the mirror and all of a sudden catching, like, oh my God, I look like my mother or my grandmother or my father today or whatever, right? Or you've been on a diet, you've been dieting for a long time, and you know what the scale says, you know what you are, you know what you normally look like, but all of a sudden you look in the mirror and you look rounder or pudgy or just softer. Some days you look in the mirror and your features look harder. I liken it to when a woman is pregnant. People trying to figure out, are you having a boy or are you having a girl? And we've been told for years, in the old midwife tales, and even some doctors have said, if a woman is spreading out more and getting rounder, they're usually having a girl. But if they're carrying in the front and all their features are getting kind of hard and they're all up front, they're usually having a boy. So it can be that way, kind of, where, and bloating can play into this and really confuse people. And hair changes, like growing out your gray, can suddenly make you look very old. A rash on your face, dark circles, anything can flare up body dysmorphia. But a lot of people with eating disorders do have a form of body dysmorphia. It is a true disconnect between the optical part of your brain that sees what's there. It's like an optical illusion. It plays with the mirrors that are in your mind and the mirrors that we look in and the camera lens that we look in. Cameras really do add 10 pounds on everyone. They really do. There's different kinds of cameras. You can look into it, but just about every resolution of camera will add 10 pounds normally. The closer you are to your camera, the bigger you are. So distance and the actual resolution type of camera you have and how the lens is in it. Right now I'm using a Logitech. If I turned it this way, I would look taller, maybe not taller, but you know, a little crooked, the way it goes like that. Okay. Let's play with some cameras to see. Okay, so when people take selfies, they tend to do this, right? They put their camera out like this and up, and they're looking up. And what do they look when they look down? They look thinner. They look thinner. And the closer you get to the camera, what happens? Your arm looks wider. So cameras can add up to 15 pounds. Whatever you tell yourself, if it's 10 pounds, it can. It depends on the monitor, the screen that you're looking at. So all these things can really mess with a person's head that is dealing with body dysmorphia. Things people say. When I was growing up, my mom always would have reference to my face, that face. What are you looking at with that face? And I always felt like I had to adjust my face. Okay. Her other concern was my posture, which, you know, it should have been, because she knew I had a curvature of the spine that wasn't being addressed for good reasons. I just had a big old surgery on my chest. She didn't want me to have a big old surgery on my back and a brace. But now I have an S-shaped scoliosis that's pretty severe, and I have one side of my shoulder that's way down here, and the other side is up here, and my hip's up here, and the other one's down here. And when you go to put clothes on, that can play with your body image too. When you're dealing with scoliosis or a curvature of the spine that's creating a hump, a curve, and a hump back, or a bulge, because a C shape goes this way, so you got a big, more of a hump, big old hump in the middle of your back, or at the top. But if you have an S shape, you have an area that's going out this way and out this way, like an S. So what's it going to do to your body? It's going to make a bulge come out of your side and another bulge come out of the other side. Those two bulges have a convex area that fills up with fat. So if you're somebody that pays attention to the numbers on the scale, that will drive you nuts. If you know that you are eating clean and you're eating light and the scale is still saying from day to day 5 to 7 pounds, you're going up and then you're going down again. Excuse me 1 second. Okay, sorry about that. So it's that wonderful time of day where my cat's going to scream his head off. Justin, leave it alone. Excuse me. I would love to let you just be a cat, but if you go accidentally and you get stung, I don't want to hear about it. And I'm currently waiting for a hornet to land so I can smack it. Okay, so body dysmorphia can come from an eating disorder, but more than anything, it's a body image over focus with a body disconnect. It's an insecurity that really, really blows up. And once you have a fear that, or you've been told that you have a part of your body that is big or small or long or you need to work on. When I was younger, like I said, my mother would always say, your face is long. If I would smile, she'd say, close those dummy gums, because I was very high gums. And she would say, close them. If I closed my face, I would look like resting bitch face. I would hear, what's with the mujalia? What's with the face? What's with the long face? I just couldn't wait. When I didn't cut my hair, when my hair got long, I would be told I looked like I was dragging down and old and frumpy. And between my mom and my stepmom and my grandmas, they would all be like trying to fix me all the time. And I was very aware of that from a young girl, that they were trying to make, the word was always, she needs a little lift. She looks a little frumpy, you know. It's a little style to her hair, a little makeup, something. Okay. What that created in me was I never went anywhere without a ton of makeup on. A ton. I didn't even want to go to bed with my husband without a ton of makeup on. I didn't want him to see me with no makeup. When I was married, I didn't want him to see my natural face. I would smile, but I would try to smile with my dress. I sounded like this. You can see my gums. And my posture was slumped over. And I had scoliosis from young. I was one of those kids that was pulled out from the nurse's office, and they were like, she's crooked. But I had just had surgery on my chest, and really, I don't think my mom could have handled anymore. And I remember the discussion. My parents were getting separated, and my mom was like, well, what do they want me to do with her crooked back? She just had surgery. That's why her back is crooked. Now it's really crooked. Over the years, I've done physical therapy on and off for this mysterious back pain. And I have one shoulder my left shoulder is much higher than my right, which you can't really notice sitting down because I've gotten into my slouch mode. But if I stood up, you would be able to see that everything is crooked. Crooked. This shoulder is down more. This shoulder is up more. If I stood up, you could really see it. If there will be days where my hip is up higher on that side or lower. So my body weight shifts according to the scoliosis. When it's pushing in one way, if I've had a good night's sleep and I've laid straight, which is why bracing is about the only thing that helps, I will actually be taller, about a quarter of an inch taller and straighter. If I've slept all curled up like this, I'm going to be curled up for a while and shorter. So if you have body dysmorphia and you're seeing yourself as a teenage ninja mutant husky turtle all of a sudden and you have scoliosis, first make sure you're not sitting at the computer too long like this, writing away, knitting away, writing away, trying to make tutorials and be like this. Don't do that. Just stand up, put your computer on a counter. You don't have to buy those very expensive desks. They have laptop things that you can rise up and stand up. You want your arms to be level, so it's really important your computer fits right and you can stand up and then sit down in between, then stand up. If you have to reach up here to get to your table, you need your chairs to come up more or your table to go down. Everything should be level. You should never have to do that. Never have to do that. Okay? And your shoulders shouldn't be up to here, so if you're stressed out, all of this can make us look bigger. All this and forward movement and nervous, this all makes everything move up and stick out. So if you're somebody with actual functional mechanical problems in your body, you're crooked, degenerative joint disease, you got stenosis, you're getting a curve, just know that some of the fat that you're feeling when you go to put your jeans on, your clothes, your bra on, or whatever, it really is the bulges from the scoliosis. It's from your spine wigging out. And you'll have days you're more inflamed, and it shifts. I would say be really careful with the selfies. Everybody has their one part of their face or something that they don't want to. I have one friend, she's like, no, don't take the picture because I got my head, how many times have we gone out with people who are waiting forever to get the perfect picture? The truth is, what my understanding of the truth is that photographers get good pictures because photographers know how to have the proper lighting, the proper distance, the proper resolution, how to angle their camera, and they know how to set you up and how to pose you too. I'll never forget seeing the movie about Gia Karanji where She was trying so hard to get back into modeling after being in rehab, and after being in a methadone program, she had gained weight. And some of the beloved photographers that had always worked with her gave her a few cover magazines, and they were also trying to cover up the track marks on her arm, and they would want her to look thinner, and they would tell her, put your arms behind your back and sit on your, and then do this, because it made her chest go up, her collarbones come out. And so there's all this positioning stuff that we can do to make ourselves look like the bones are accentuating, like we're thinner than we are, and we do it. And then there's filters, and that plays with our head. But there is no true picture of us. There is no true mirror that's showing us. When we look in a camera, it's either flat and wide. It's going to widen us out 10 pounds. If I stand up now, it's going to look different. Watch. Show you what I mean. So walk away. Okay, so you see distance, distance, distance. See, right? All right. So when we're sitting down, we're like this. So our stomach does come out. I know so many women that are afraid to have a picture taken of them sitting down because they get the little, look, they get the little muffin top. That's normal. That's normal. All right, so some of the things I've found to do with body dysmorphia, and I'll show you a quick one, is first, take a pair of jeans that you know fit you. Try to wear your jeans. Try to stay in your jeans. The more we wear leggings, I'm not saying don't wear leggings. I'm wearing yogi pants now, and I'm wearing my loose fitting clothes because it's kind of hot. It's like 87 today, so I'm wearing my thin clothes around the house. But in the quarantine, we all wore bicycle pants, yoga pants, pajama bottoms, sweatpants, right? And what did we do? We gained weight. Not because we were just sitting, but because sweatpants, yoga pants, jeggings, leggings, it's sort of like being a goldfish in a bowl. It really is. As you adjust that bowl, the goldfish grows to the bowl. Can eat more food, can grow more. Give it a bigger bowl, it can grow. And the goldfish just keeps growing. That's what we do when we wear loose fitting clothes. Right? So challenge yourself to wear your jeans. And try not to look at yourself with your jeans on. Just wear them. Because the first thing that will happen is what I think the most devastating thing that I didn't understand about body dysmorphia that my therapist had to explain to me years ago is it actually creates like a tactile stimuli where clothes feel too tight. You go to put something on that has always fit you, and it just doesn't. You can't. It's scrunching up. It's bunching up. It's bad. You're uncomfortable. And that is part of body dysmorphia that not many people talk about, is my clothes feel tight everywhere. If I were to put a bra on right now, it feels like it's crushing me. If I was to put a pair of jeans on, it feels like it's sucking me in, it's strangling me. That is part of body dysmorphia. We've already looked at ourselves in the mirror and said, and allow your eyes to adjust. When you first look in the mirror, if you do look in the mirror, just to check yourself out real quick. You're going to look bigger than you are because you're going to find what you're looking for, and you're going to look and fear. You're going to, whatever you're fearing is what you're going to see. Our focus does go on our fear. So if we're fearing we're going to look big, if we're used to looking big, that's the first thing we're going to see. But the other two tests you can do with your genes are, these are great make. I want to tell people about these. They're Martha Stewart, and of course Martha Stewart does everything wonderful, right? These are 10 petites. Now, they're actually too big on me, but I bought them during a time that I'm going through a hard time with the scoliosis, and one part is of my hip is snugging in, and right? um, and I felt big, but I wasn't that big. I'm really like a 7'8", but I can only wear them for a little while because then I bloat and I feel uncomfortable, so I go back to the 10s. The truth is, if you can fit 2 fingers down the back, the front, or the sides of your jeans, you're fine. They're going to fit you. And if you take the waist of your jeans and you put them all the way around your neck, and it connects the waist around your neck, they're going to fit you. So that's a reality test you can do. Another check, scan, reality test you can do is, like I said, wear jeans for a week. When you look in the mirror, back away from the mirror. Turn your head. It's just like if you had cataracts, or if you were trying to fix the muscle in your eye and focus. First thing you're going to see is what you fear, your expectation, what you fear. Oh my God, I'm going to look big in this, right? And you do. You see yourself as big. I see myself as big. Give it a minute or two. Look away. Look back. Catch yourself in the mirror like, I don't look big anymore. I look like myself again. I recognize myself. Now with GID, MPD, this can get confused with, it's a disassociation. It can be confused with, if you say to a doctor, I can't recognize myself, I see a big person in the mirror, and you have post-traumatic stress, and you have complex post-traumatic stress, and you have a background history of dissociative states, they can automatically file that under derealization, depersonalization, dissociative feature, and overlook the body dysmorphia. Then we have a lot of folks that, because they don't see themselves as they are and feel good in their body, or sexual in their body, they might start to question their sexuality. It really does all go under body dysmorphia. They used to have, I posted about this on Facebook because it's so annoying to me that there are so many labels now in LGBTQ on the spectrum. There's aromantic, there's demisexual, there's gray romantic, there's bisexual, there's, it goes on and on. And I wonder why we're over defining ourselves, and if sometimes body dysmorphia doesn't become part of the problem of that, trying to fit and see ourselves as what we are, our real self. We don't feel like our real self. And if our weight is fluctuating all the time and mechanical issues are going on, like humped over or whatever, hair is graying, not wearing makeup, you might feel like you don't look like yourself. And like I said, we've all caught ourselves in the mirror where we've looked like our mother, our father, or our grandmother. But what I do when I'm having a real flare-up of body dysmorphia is I allow myself to get into some loose-fitting clothes for a day or so. Just bum out, take the makeup off, whiten my teeth with whatever I'm using, smile in the mirror a lot. When I'm walking by the mirror, Stop, smile. Some people avoid mirrors completely, but I give myself at least 5 minutes after first looking in the mirror. The worst fallacy about body dysmorphia, the worst misconception is that people that look in the mirror and see themselves as fat when they're skinny, or people that look in the mirror and see themselves as skinny when they're actually overweight or fat, or people that concentrate on one part of their body like their nose or their mouth or their breath or whatever it is, that they're just conceited, that they're just overly involved in their appearance, their vain. That's not true. Somewhere somebody told them, you look like an old lady when you do that. I grew up hearing, straighten your posture, you look like an old lady. Straighten your posture, you look like an old lady. Straighten your posture, you look like you're old. My mother would say, stand up straight, you're going to look like your grandmother, her mother. Don't open your mouth, you're catching flies. If I fell asleep, mouth open, you're catching flies. Look at you, catching flies. If I smiled, dummy gums, cover your gums. Now I looked really dumb. Okay, don't ever smile big. Don't do that. Keep your mouth closed. Look at those eyes. Dark circles down to here. You're dragging. I mean, that's how she said it. And I think those were her own fears. And please understand that what our loved ones say to us as we're growing up, we do look at on our body. When we wake up in the morning, we're the first person that knows we got a pimple. And if somebody else says, what's that on your face? We're like, seriously? If we already know before we wake up, if we're feeling, if our stomach feels still big, if we feel, we know. If somebody is still like watching what we're eating and looking at us and mentioning when we gain 3 pounds, when we lose 3 pounds, best thing you can do for somebody that is struggling with body dysmorphia and they may not even know they are, because it's such an inner head game, really tormenting when the feelings come along with it, because suicidal feelings, self-harm, it can set up your whole day just by getting on the scale and seeing the wrong number when you know you're doing everything right. It can also set up your entire day wrong when you try on your clothes you just wore yesterday and they don't fit today. And you can tell yourself, oh, I ate some salt or I ate late. But when your weight fluctuates 4 to 7 pounds, because maybe you do hold on to sodium, maybe you have a curve, a functional thing going on, a tumor, something that is flaring up, your weight will fluctuate. All these things just feed into body dysmorphia, and when it gets mixed up with DID, MPD, and sexual gender, it can really be confusing. So don't keep that from your therapist. Share that struggle that's going on in your head when you look in the mirror or a camera and you want to be part of the family photo. You want to be there, but then you look back at the photo and you're like, it doesn't look like me. Who's that? Who is that? So I had some other tips, but I've totally lost. I should have put them on the note card. For people with scoliosis, I would say find adaptable clothing. And if you cannot, then go to a tailor or learn to sew. Oh, here's the other thing. Don't be tempted to just put a big potato sack on. Don't be walking around with oversized clothes. When I first lost weight, going from 180 something to 100 and something, like 110 or 100, I really never saw myself as thin yet. So I kept reaching for clothes that were like a size 18 to 20, which I was never. But that's wearing bigger clothes can actually make you look bigger and sloppy and frumpy. and they won't fit right, so they'll swirl around your waist and they'll feel tight, and then the tight will confuse you and make you think, I'm big again. Another thing, if you're not eating, if you're fasting, if you're doing clean eating, you're skipping meals, or you're intermittent fasting, be aware of your breath when you're talking. I'm always aware of it because I'm an air gulper. If you are an air gulper and you talk fast, and the reason I try to talk fast, is I'm trying to get over these nodules, which are more now right on my trach tubes. So they're compressing. When they compress, I always have heartburn, so I'm always full. I'm not hungry. And it's hard to take a deep breath. And when I'm talking, I'm actually talking, I can feel myself talking above them and forcefully forcing the air out, and shallow breathing and air gulping. So I'm not only jugging like a goldfish or legging like a goldfish, but I'm breathing like a little guppy. So be careful of the air you're breathing, because that will make you bloated. I'm going to say something that a lot of women aren't going to agree with, but Spanx are probably the worst thing. Constrictive clothing is the worst. I know I'm saying wear fitted clothing, not too loose, but not too constrictive. Watch where your clothes fall on you. If they fall mid-waist, high-waist, or hip level, that will be very important to how you digest your food. Because food really can get hung up. If you're short-waisted, short, food can really get hung up in your esophagus. If you have chutes and ladders, a twisty gut like I do, it can take a long time for your food to make its way through you and give you that apron hanging looking stomach until everything calms down. So just be aware of the mechanical things that can make you look bigger, the structure and the mechanical things anatomically in your body that can make you look bigger, feel bigger, but the emotions that go with it and the tapes you're running in your head, like don't smile or smile, because now you look like you're Mujalia, you're as my mother and my grandma would say, your long face, you're pouting. Not pouting, you're just, this is your face. You got a long face. You know, I think people can still see our smile in our eyes if we have to wear a mask. I think we can smile with our eyes. Try to. And I don't want to say avoid mirrors and cameras, but I will say it's all funny mirrors. It's all an optical illusion. So if you get to starting to play with filters and thinking you need to selfie everything, that's not good either. Let me know what you think. I mean, let me know what you think about body dysmorphia in DID and body dysmorphia in sexual identity, and then body dysmorphia with eating disorders, and what you did to overcome that. For me, I try to go by my clothes and not too much how I look. But when I don't think people talk about the dysmorphic feelings of clothes feeling too tight and nothing feeling like it fits, and the very real dysfunction of not being able to get out of the house because you just can't get dressed. Nothing is working. You just can't. You've tried on a million things and everything is too tight or riding up or you're struggling. And that could be mechanical issues like your spine, or just where your weight is shifting. So I think we've all been there a little bit, But if you struggle with it, just let me know, and reach out to somebody and share your scary thoughts with your therapist. Okay? Take care, everyone. Have a nice day. Bye-bye.